what about being able to liberate yourself from the healthcare system by making good, healthy choices in the first place? Can you discuss that?
Sure. So, Shawn always says that health is the best insurance policy is yourself and making those choices. And I absolutely agree. What we do every day in our habits makes a big difference as to whether we have to access. And not so much if you got hurt in a car accident or something like that. We always know that those are things that, you can't plan. But your everyday habits do play into whether you have a chronic illness, or if you do have a chronic illness, you do need to work on the things that you have control of. And I think that's one of the biggest problems with our sick care model is we don't give control to the client or to the patient that we are in charge of our health and we are in charge of our everyday decisions. So whether it's food, activity, or sleep, making those choices are super important, and finding somebody that's going to help you do that and understands that. So we have the analogy, would you go to the dentist with crooked and yellow teeth? And most of us wouldn't, but we access a healthcare system right now where the person in front of you is not a healthy individual, and neither are their outline staff. And so they're not promoting the activities or habits that we need to have a healthy body. So, I always tell people, think about that, beware of that, Yeah,
as healthcare professionals, we should be good role models in our health also, right?
Yeah, I agree. Set the example. And also somebody should give you the options that you have for, if you have high blood pressure, talk about the discussion of foods that would help, activities that will help, sleep that will help, to be able to get to the root cause and to eliminate things. Don't always jump into taking something for the rest of your life and assuming that that's going to be the norm.
Yeah, 80% of all doctor healthcare visits are due to chronic disease that are probably preventable, whether it be hypertension, whether it be high cholesterol, that's a whole other story, or whether it be sleep apnea, or whether it be type 2 diabetes. Yeah. Those are all preventable with lifestyle changes or reversible with lifestyle changes, but that's not what a lot of patients are told.